Hi everyone, welcome back. Fiona Whirler, SandTray therapist and trainer, and it's my very great pleasure today to introduce Lacey Fisher, and Lacey is over in Austin, Texas.
Yeah.
So welcome, Lacey. How are you today?
I'm good, just winding down the day. So this is a nice way for me to end it, to be able to talk about something I really love talking about and could talk about forever.
It's a bit like that, isn't it? Now, Lacey, can you please tell our listeners, I've got your bio here, which is very extensive. So you are a licensed professional counsellor and supervisor.
Yes.
You're a registered play therapist and supervisor.
Yes.
And a certified perinatal mental health clinician.
Yes.
And I guess that's kind of what we'll be talking about today. And you founded the Open Heart Counselling of Austin. So everyone, she's in Austin, Texas.
Yep.
And you have a small group practice over there.
I do. Some associates, so supervised interns, basically, that are learning, getting their hours, and then a few other associates, or they've stayed on with me. And so we have a practice of, well, everyone under me is going to learn about perinatal mental health, but we do have play therapists. Everyone likes working with grief and loss, sexual trauma, and then all the things that go along with birth trauma, fertility, struggles, all the things that go into all those areas. So we have a good diverse range of things that we do here.
A large range of human experiences from birth to kind of death, actually, yeah. It sounds like. Yeah. So Lacey, you became passionate about working with parents that struggle with perinatal mood and anxiety disorders, specifically perinatal PTSD, after your own experience of becoming a mum, and you experienced trauma after your newborn was unexpectedly admitted to the NICU. There is a huge story right there. I had to, when you sent that to me, I had to sit with that, and I really, I just felt that in my heart. Newborn little Bubba. Was it your first one?
It was, yeah.
Well, yeah. Not that makes any difference, but
right, doesn't. But still, kind of going into it the first time and not knowing what to expect about anything, and then having that experience that was completely unexpected as well. It does a lot, and I did not know that postpartum or perinatal PTSD was a thing. And then I experienced that and it was like, oh my gosh, it is. This makes sense, because it can really increase that anxiety that one may feel in the postpartum period. A lot of things that go into it. So yeah, that is when I really got passionate. My prior work was working with mainly children of sexual abuse. And then I extended that into the lifespan, working with anyone who had some kind of sexual trauma. And after that experience, I just realized, wow, I've even seen some moms and I don't know that much about perinatal mental health. I really need to know more, because then I had this new insight that I had never had before. So I decided to turn that direction, which I know happens for so many of us. We have an experience and it just opens our eyes to something. And that became my new passion of everything perinatal related. And of course, being as SandTray has always been a big part of what I do with children and adults, it worked great for this population. So I kept that going and then made a specialty out of that.
Okay, because if you're walking into a space, a clinical space, and you're not aware that your therapist is a SandTray therapist, how is that? How do you explain that? How do you introduce that to, say, give me a scenario, say a mum who has perinatal PTSD. How do you do that?
So most of the times now that we've all switched to telehealth a lot, when someone gives, I'm able to give, if they reach out because of my specialty and they want to see me for those things, if I'm doing a Zoom consultation, they see all the things in the back. And when I'm giving my little, kind of blurb about the type of counseling I do, I'm say SandTray therapy is something I do. Now, I'm sure you probably have not heard of that, and you see all the things in the back. I want to say that's something I use, and maybe give them some brief examples of what it is. But then I tell them, if that's something you're interested in when you're in here, I'll tell you a lot more about it, and we'll see how you feel. And so when someone is coming here for the first time, because I do have a lot of miniatures, it can be very overwhelming for people. And I remind them again, this is something I use, even though it's considered a play therapy. It's great with kids, but it's so amazing for adults as well. And it even looks different for adults. So I want to let you know that eventually I might bring this up to say, if I ever feel it would be a good intervention for you, because it's just another way for us to express things that are going on. It's, without always having to use certain words, or people describe really liking it because they see what's inside of them in a different way. It feels so different to see it out in the tray. And kind of contained in a way. Many people have gone through the experience and say, just that thing that I was feeling about myself in here, it felt stuck. Now it's there. And even though it's painful to look at some of the things that people have created, they're like, it just feels wonderful that it's out of me and it's there. So I kind of let people know too, the good experiences people have had with it, and also say, you may not like it. Some adults really don't, and just entertain me. Let's try it once or twice. And if you really don't want to go back to it again, we don't have to.
Yeah. And I think that's a big misconception in our industry, is that it's play therapy. It's SandTray therapy, and adults can do it as well.
Yeah.
That's great. So you must have some really interesting stories. I'd love to be in one of your trainings where you, confidentially, of course, everything's confidential, tell about those aha moments, or when you were just expressing them about, that feeling that, and then letting that go. I know just in a general conversation, it's like, yeah, right, whatever. But really that instance of letting go, of seeing your broken heart in the SandTray, or the death, or the whatever it is, that's so significant. That's life-changing, right?
It is. I think for so many people, I am thinking of so many examples that come up, because I do this with so many people are like, oh, you do it with just a couple of adults? I'm like, mainly all the adults that I have that come in person now do SandTray at some point. And I do have a training that focuses really on the perinatal loss and trauma, where I do discuss the different dynamics of the different types of loss and trauma that people commonly experience, and then show examples of what their SandTray process looked like, just so it kind of helps bring into, oh, these are the dynamics that, yes, I can get someone to talk about and express maybe how they're feeling about it, but it may take us some time to get there, right? Where the SandTray really can put that there for them and bring it up when they're ready. And then, oftentimes it's kind of like this aha, that people are looking like, wow, I didn't realize how much I pushed that out of my memory, and how important it feels that it's come back up, because it needs a place to go.
Yeah.
So with that, I'm thinking in particular, there was someone who came in after it was quite a while, several months after she had an elective termination for medical reasons. And it was so interesting. Her trays would have 2 or 3 miniatures in them each. She did 3 different trays. And while they seemed so empty, it was kind of representative of a lot of what she was feeling. And there were many times that she would look at it and it was really hard for her. But she said, I just realized how much shame I'm carrying, even though this is something that, she does not need to feel shame for or guilt for. That's part of the trauma. That's part of her society. telling her that that was not an okay thing to do, but, we got to work with reminding on where she was and making the best decision she could for herself. And while the first 2 trays were really intense, and you could tell that she was really struggling with, does this make me a bad person? Does this make me a bad mom? She said that it just was so helpful, again, for her to see it out in front of her, that she got that distance that she needed, and to address that is there. I do blame myself for a lot of these things. So when it comes up, then we get to work through those mistaken beliefs, those things that are inaccurate, that maybe the trauma or the grief, keeps convincing us that's true when they're not. And then eventually, although her trays never had more, like a lot of miniatures go into it, there was a time she looked at it and she just said, I am feeling more peaceful. I do, remember why we decided to do what we did. And at that point, she was ready to move, forward with the subsequent pregnancy. And then we did some coping around that for her, because that's something that comes up too with anyone with loss. Subsequent pregnancies can be really anxiety provoking, and a lot of that shame and guilt that they were feeling can come back up. So
yes,
it was just
and we know that can lead to harm to the baby, and all sorts of other adverse events as well to that unborn child. It's a huge subject. And if anyone's watching now in Australia and they're thinking, I need Lacey, well, Lacey and I are talking about doing something together, aren't we?
We'll try to figure out something for sure.
Yeah, I think so. Like, I've got the training rooms here, so maybe we can have you on a big screen and hands in the sand, because I'm a big advocate for having that that presence, that you've got to have someone that is feeling the room, feeling the students and containing them.
And it's so great too with the workshops that I do. Everyone, there's the experiential pieces too, so people are in there and we're processing our own reproductive history, whether you have a child or not, whether you have chosen to be childless. There's still reproductive.
You are a child, you are someone's child, right?
Right. Since we're children, and that's what we're like, we're going to grow up and have kids. So there's a lot of stuff that's there for people, or invite them to create a story around something they've heard from someone else. And people were just so amazed at like what got to come up in their sand trays, either thinking of someone they were really scared for, or for themselves being like, wow, I process a lot about my own birth, or my different births that I've had, ones that they give, not them being born themselves. And they're like, I just never saw it that way. This gave me a whole new way to look at it, and it felt healing for them.
And I have to tell you, my daughter is a midwife, and so this conversation that we're having now, we have a lot together, because of course at that point, at that moment, it's really significant who's there, how the baby was born, if it's wanted, or so many factors. And of course, it's always the mother that carries that love, that nurturing, but then that shadow side, or that other side, that shame, that blame, that guilt.
Right.
And of course a lot of these midwives carry these heavy emotions as well.
Oh, the secondary. I was part of a group for a bunch of doulas that were getting trained, and they wanted someone to be there to process the different traumas that they were going through from the secondary aspect of it, because they're seeing things, they're dealing with, the loss and things happening to the birthing person, and they need a place to cope with that as well. I mean, there's such an increased risk of secondary trauma around birth work like that. So it's good in that way. It's good for everyone to be able to process it. And I just love the sand tray for that, because then now I get to have wonderful, I should have brought them over before.
Is there one piece?
I have so many. I can even send pictures.
What's your favorite,
some of my favorites.
Okay.
Well, So some of my favorites here, I have so many, and my whole office here, I have 5 spaces. And one of them is a big SandTray group room, and I have even more miniatures.
Beautiful.
They're all floating around. But so some of my favorites, and these are important to have when you're working with this population. So of course, anything medical trauma. So here's an incubator, which is one of my, personal favorites for NICU related trauma.
Wow.
When I think about infertility or trying to get pregnant or loss, they have these wonderful little torsos. One has baby inside, one is empty.
I've got that. I've got
yes,
that.
They're wonderful.
Isn't that clever how you've taken the baby out of one?
Yes.
I know
yes. Okay. And I even have the marble of the other baby rolling around. So over there I have several different size fetus that people can choose if needed. And then this one, see the angel baby with the hole in their belly. And these miniatures, when people look at and they're there for this, they're like, wow, that is the first tray or the first shelf I looked at. That must have been there for me. I'm like, I do have a lot of representation of different things. And they'll say some of it is really hard to look at. But then, again, I was just so happy to find something that represented what I feel on the inside and have a new visual of it in that way.
And sometimes with this expressive therapy, SandTray therapy, you really are giving your clients that healing space. It's a word that we don't often use, and I think we need to bring it back in.
Yes,
because it is healing.
Absolutely. It just the fact that someone can create a narrative or have their narrative and put it out, express it in this way. It's given all the good things for them, right? Connecting both sides of their brains, helping integrate their trauma. What it also is doing is when they're able to share it, then they're giving that narrative to you and you are there to witness it. You get to witness it in a different way than just with their words alone. That's healing for a lot of people, right? That's what you have to be able to do when you're working with perinatal trauma and grief, really hear the hard stuff and be able to let them go there, because they get that a lot from people in their lives of like, oh gosh, that's, that face of, I don't know if I can handle hearing that. And so the people often back up and won't talk about their loss or their trauma. So that's healing, that you can give them that space to do that. But also when you just like, many have said, this new visual that I have, it's like, now it's like a new form of the story. And then they got to share that with someone who was really receptive to witnessing that journey, that struggle, that loss.
Absolutely. And we all have stories. That's what makes us human, right? We have stories, and some people like to put different flavors to their birth stories. And
and that's what you said, birth story. It's important that we ask every person, whether it's the birthing person or the non-birthing person, tell me about your birth story. What was that like for you? Because so often the shift goes straight to, how's the baby doing?
Yes.
And the parents really feel like, wow. I had a mom describe, and even in one of her SandTrays, she depicted her birth story and said, although everything was fine in the end, there was a lot of trauma that went on with the baby. And she said, even though everything was fine in the end, I feel, and she had to picture like a stretcher that I have with a person laying on top of it, and said, I just feel like this vessel that carried this baby, and I delivered it. And then I was just an empty vessel. I was nothing anymore.
That's so sad. Yeah. That was just how she felt at that moment in a hospital, because I guess I have a little bit of a bias. My children were all born at home. So I'm not a big fan of having babies in hospital. I do understand that under a midwife, they will, if there's any risk of harm, they will say you need to go to the hospital. But the statistics really do speak, in Australia anyway, the statistics are leaning more towards it's healthier and safer to have a baby at home. And a lot of people think it's the other way around, but it's not.
Yeah, and it really, it comes to, and because I know a lot of people say that they're going to feel more comfortable in the hospital setting, but especially what we see a lot of research and data on here in the States, especially in Texas, where I'm from, is that women of color, especially Black women, have way higher maternal mortality rates and risk of perinatal mood anxiety disorders or traumatic births, things in the hospital system. So there is a preference for a lot of people to have those home births, and there's some great organizations around too that try to encourage home births, especially for Black women, and make it more affordable for them, so that they can have that. Because a lot of clients that I've worked with, especially, like I said, Black moms have had that fear of like, I'm afraid I'm going to go in the hospital and I don't know what's going to happen, or I'm not going to be listened to and heard, because they've heard of the statistics, they've heard of the stories.
What a terrible way to start your birthing process, hey? What a terrible way to start your birthing process with
and then again too, I mean, I will have to say, like, I had a hospital birth, and I know plenty of people have had wonderful experiences in hospital birth. So I would never bash, either one of them, but I do a lot of work with and talking with some, doctors afterwards, and done some other trainings to say, here is what I'm hearing on the other side, how people felt after their birth, maybe not feeling heard or listened to or given choices or informed consent, but it's just stuff that we can all learn to help us grow when we're around people during the birth process.
The Australian Indigenous peoples, they call it women's business, and I think we kind of need to get back to that sort of mentality. It's women's business, and how can we make it for the woman, because it's the woman birthing, and she's got to feel safe and contained, as
and that's
that temenos for her.
And that's why I love the idea of doulas, to have someone there to advocate who really knows what's going on, can help, because when people are giving birth, there's a lot going on with their mind that is not, you're not using this part of your brain, right? So you have someone there assisting you with that. And a lot of work that I do with people is they come to me and they're like, I had a really bad birth experience, have a lot of trauma for that, and I want kids, but I'm afraid I won't do it again. So can you help me? And so we process that trauma of the bad birth and get them prepared for the next one, whether it's a hospital birth or home birth, or in a birthing center. Let's get you connected with a doula. Let me talk to your providers so they can be aware of the traumas, whether it's trauma from the previous delivery experience or trauma from earlier in life, like sexual abuse, any prior procedures like infertility treatments are very traumatic in themselves, and that can come up during birth for people. So there's a lot that goes into people's birth, and so many people don't.
There's a lot that goes into conception as well.
Oh, absolutely.
I mean, that's a whole different topic, isn't it? I mean, we could probably talk about that in a whole different interview, I think, because I've worked a lot with that myself, not because I used to be a sexuality educator, so I can quite easily talk about, use sexualized words and hear different stories. It doesn't faze me. And I think I think how you are as a person is what you attract. So the SandTray therapies really opened my eyes to the depths of that non-verbal ability of it, and how people can actually remember their conception in that felt sense. It's just bizarre.
All that stuff. Yes, we're carrying all of our lives from when we were conceived, and it's amazing. Epigenetics, everything that goes into it. But I do love that, because it brings up just things for people that they're like, it was always there, but now I feel like I have something that I can put to it. And the same with when people do give birth. No one ever really talks about this. No one explained it to me, but I had a therapist at a training say, giving birth is a portal to open up all of your old traumas, all your unresolved wounds. And I was like, wow, it was so true. Everything that comes up about your own parenting as a child, the things you felt as a child, your relationships with your parents currently, so much. But that's why
that's why they don't tell us.
I know, right?
The human race would be extinct.
But that's why, you know, people like us are out there that we can help say, yeah, now you're seeing some things that you never thought would come up again, or we're there. Let's go ahead and let's dig into it. And SandTray is great for that. I mean, not only do I use it for trauma and loss, I do use it for people who are going through postpartum depression, postpartum anxiety, because there's a lot of things that go under the umbrella of perinatal mood anxiety disorders.
Yeah, absolutely. Sounds like you should write a book.
Well, I've been asked or encouraged by Dr. Linda Homeyer to submit an article for the World Sand Therapy Journal, or the I always get the title mixed up and I need it in front of me, but the World Association of Sand Therapy Professionals. I just submitted an article about a case study. And I wrote so much on that. And I was like, this is only about one element. This is about a pregnancy loss around 15 weeks. Like, that's not even including all the other stuff and the different types of losses that are out there, because any loss, no matter how early it is, it can be very devastating to someone, because there still was a plan, there was hopes, there was expectations and dreams of what this was going to be. And a lot of times people who do not make it full term and are not, you know, able to deliver a living baby, or they do deliver a living baby and shortly thereafter it doesn't survive, that a lot of people feel shut down, like, especially if it's early pregnancy loss. Well, you never met the baby, you never had time to really form an attachment, and this is a reason, there's a plan behind it. And there's so many things that are so just harmful that people say, and so it totally invalidates the loss that people have.
Wow. Yeah, well, that would be great if you write that article and then we all have access to it. That would be fantastic.
If it gets approved, it'll be in that journal, which I believe is free. I've read them. They come out on that website.
Oh, it's amazing. It's so good. It's like a link for everyone in this. I call it our village.
Yes, I know. There's quite a few SandTray therapists in Austin, but then I'm like, oh my gosh, there really aren't that many. And I'm connected with those, and we all have the different areas that we like to work with, and mostly in the perinatal community, there's even smaller amount of people who do SandTray. So I'm like, would love to connect with more people. So when I've given the training, I will offer a virtual option, because some people were in Canada or like in the northern part of the United States that definitely could not come down to Austin. And while it's different, we did some virtual SandTray and they still got to experience it. But I still, love having people come in person. And like I said, I could talk about it all day. It's been a 1-day training, and a lot of the feedback I got was like, let's make it a 2-day training, because there's so much.
One day's not enough.
Yeah.
I think the first day you're getting your own stuff out, right?
It's amazing stuff. But maybe one day I can find a SandTray book to make a chapter in, or we'll see what comes up.
No, it's great. And as I said, there's a need for it in so many different areas. And I think we spoke before about training and how quite often people do an introduction or a 1-day or a 2-day, and then they set up as therapists, and that's where you can do harm, isn't it?
I recommend, especially because I try to say in some of the training that I do, this is a good starting off point if you want to get into the deep work, to pique your interest in SandTray. But yes, needing some deeper trainings, understanding around it, because again, there are so many ways you can go with it. And when you're talking working with populations such as trauma and grief, there's already this bit of sensitivity, this bit of trauma-informed care that you need to have anyway. And then implementing SAND, it can go so deep so quickly. And if you're not, ready to know how to facilitate and guide someone through that, it could be hard on some people, right? When they're leaving there. And so knowing how to open up the session, that SandTray session, and be able to, close it appropriately, contain it. Yeah, I mean, it's I've been doing SandTray for years. And there's so many things I'm like, oh, I need to learn. I want to learn. And I love good SandTray trainings. You get to learn different, ideas, ways to get in there, ways to pull people into the tray, pull them out, looking at the tray from different angles, adding if they need to, taking away if they need to. So a lot of little tricks and stuff that I've learned throughout many years of it that I can implement.
Absolutely. Yeah. And I always say to my students, I'll give you this really good grounding, quite high level training, and then you need to go off and do some other PD, some other training, so that you can really consolidate and find you as a therapist and integrate everything that you've learned. Because there are some amazing trainers out there like yourself that are really professionals or experts in a certain field. And if your interest is piqued in that field, then it's like finding a supervisor, isn't it? You've got to find that supervisor that just clicks, that has a similar way of thinking or doing. So we really do need to
and you yourself have to be comfortable with the tray, and you definitely have to do your own trays. You have to know what it's like to be on the other side of that. Because so much of your stuff can come in. I do remember there was like I said, this incubator is one of my favorite miniatures, and I had a NICU mom, and we were working through a lot of stuff. She had done a series of trays, and I kept expecting her to go get the incubator, and she never did. And I was like, I kept looking at it, and I really wanted to hint at it. And then I was like, I got to sit back and realize she was done with it. And even though her SandTray still talked about the NICU, that was something that had been in there before, but she was ready to move that out of there. So
she'd healed.
Absolutely. And it was, And then also, if I see the incubator, not assuming that it's always going to have a terrible memory associated with it. It may be yes, I do remember the first time I actually finally got to touch my child, because I didn't right after birth because they were whisked away. And the first time I touched them, they were in an incubator. And this was sad and scary, but also it was wonderful. So, just the other thing too, of not putting our assumptions on what the things are. We can let them guide us, give us a pretty good idea, and we just hold those and see, if it comes up and out, and if it's the same for them.
Absolutely. And I love that you reinforce that you need to do your own process, because I always feel the deeper that you have gone yourself in your own process, then you can hold your clients when they go deep, because you know it, you understand it, you know where they're at. And you're not jumping in and rescuing, saying, oh, come back up. You can say, it's okay, stay down there. It's okay. I'm here. You need to do it in your time.
Right.
So absolutely. It is that gaining of wisdom within, that SandTray therapy framework. It is about pulling yourself apart and having a look at all those different aspects of self. It is bringing your own story in and understanding everyone's story is unique. But we're all kind of working with theories, right? So we're looking, at those traumas or the unmet need, and that's also tricky, because when you're first starting out as a therapist, you may overlook that, or you may expand on something that you think is there, but the client's like, no, that's fine,
Right.
And so we all have a nice rupture.
Yeah, absolutely. And with rupture also brings that opportunity for repair and deepening and our relationships with them.
Yeah, absolutely. Absolutely. I wanted to ask you that you founded the SandTray Association of Texas.
Yes, so I co-founded, it's called Texas SandTray Texas. Oh my gosh.
Take a big deep breath.
So where it originally started out was the Austin SandTray Association, and we developed that to move it statewide to start offering certification. With the definitely, because like I said, there's so many different ways to go about SandTray, and this one has a particular way of being, kind of more really non-directive, and there's certain level trainings that you go through and you can get a certification. So I co-founded that with a group of amazing SandTray therapists here. And it's hard to be on a lot of boards. I then turned my attention to, like I said, when I shifted my focus to perinatal, I moved to the Pregnancy and Postpartum Health Alliance of Texas, which really serves the Austin area. But our goal there is to educate professionals, whether it's mental health professionals, doctors, nurses, doulas, as well as the community on perinatal mood anxiety disorders. We also have a list of trained therapists that are specially trained in perinatal mental health. And for families in the area that are not able to afford services, we do have a voucher program for mental health therapy and psychiatric services, because the need of it's there. There are a lot of people who understand perinatal mood anxiety disorders, but there's also a lot of people who don't understand the ins and outs of it and do cause a lot of harm, or people have really not benefited from certain comments or statements. So we like to be sure that they have access to people who understand it, who have this special training.
Yeah, because it's when you're at your most vulnerable, isn't it?
It's a very vulnerable time. A time of confusion. And think about it too, when someone is so foggy in that time because of sleep deprivation, hormone changes, not being able to shower for days on end, right? Like it is.
Or if you're a single mom and you're doing everything on your own, you got no support, that's a double whammy as well, isn't it?
So difficult. Just think about from the trauma aspect of how so many people are affected by a trauma, the birthing partner, and then let's say the person who is the non-birthing partner. I've heard so many times that, let's say in this case, it was a father who was looking at the situation as like, I might be losing my baby and my wife. And that amount of trauma that is there that never really gets talked about. And so it's, we like to advocate too for the non-birthing partners, like you can get perinatal mood anxiety disorder as well.
Absolutely.
Let's talk into someone too.
Yeah, absolutely. And I'm even thinking now as the mother of the birthing mother, because you have that, you never lose that connection with your children. And it's such a big subject, Lacey. I'm so, I'm definitely going to get my daughter to watch this, and she will love the work that you're doing. She'll be so supportive.
No, and I love what you just said too about being the mother of that. I think too, there's even need for grandparents in that as well, because this is an example of how we don't really lose our birth story. Those things, the person who has given birth, things may come up for them because maybe they went through a trauma. And if they see their child going through that same trauma when they're giving birth, it can bring things back up. And also, wow, I have a client who came to me and she was like, Lacey, I am 17 years removed from having children, but I know you work with NICU trauma and I've never processed my NICU trauma. And she said 17 years later, my child is getting ready to go to college, yesterday. And things are coming back up for me. It stays with you.
Yeah, absolutely. Wow. Oh, that's amazing. Well, I'm very mindful of the time.
And yours as well. We're in such different time zones. It still blows my mind that you're in tomorrow.
Yeah, it's amazing. It's like it's one world, but it's kind of parallel universes, isn't it?
Yes, and I'm in your past. You're speaking to the past. I'm speaking to the future. It's amazing.
Wow. Oh, look, it's been amazing talking to you.
Thank
You're doing
you so
such
much.
great work, and I would definitely let everyone know in Australia that I'm sure Linda's going to pass your research paper. That would, it sounds amazing. We'll get everyone to read it. And yeah, we starve over here for PD and courses. We do have a lot of really good trainers, but it's interesting because a lot of our original trainers, they're aging, so they're retiring, or we've lost a few really good people who did some great work. So yeah, tides are changing over here, so I think we've got to work together and share the joy. I certainly always recommend to my students, where is it, the training book, Linda's SandTray Therapy manual. It's such a good resource. So yeah.
In the paper that I wrote, I did write it from an Adlerian SandTray perspective, but in there you'll have some great references. The Home Iron Sweeney and Home Iron Marshall also have an advanced clinical SandTray manual as well. But there's so many that even I think they're going to release one too. I believe about Adlerian SandTray therapy from Terry Cotman and her partner that she works with. So that I'm thinking will be coming out soon. So that's going to be great. I pulled a lot from Terry Cotman as well, and Eliana Gill, just great SandTray stuff. So read the references. If anything, give you great ideas about books of where to start. If you are just like, I'm starting out, I don't know, I want more training. Yeah,
absolutely. That's a really good tip. Yeah, for sure. Yeah. Because not everyone likes, for example, Gestalt SandTray therapy. Some people prefer the humanistic approach, or you've got, with us, we're really looking to, what type of assessments can you use that are just SandTray therapy based assessments? And I think that's an area where we could all work together. Yeah. I know I spoke with a beautiful student from your neck of the woods, and she was doing her PhD SandTray therapy and using the ACEs, and she was going to put an assessment together. So things like that really consolidate the validity of SandTray therapy as a psychotherapeutic model that we can use within mental health and well-being. So,
and like you mentioned earlier, you said integrative sand therapies, and that's, but I do have the Adlerian route, but there's a lot of different things, just kind of depending. And this is where when you do the practice enough, that you start to figure out who you are as a clinician, when there's times you're going to maybe use a certain approach or be a little more directive, or when you're going to stand back. So it's such a wonderful modality for the therapist and the client.
Yeah, absolutely. I think we're going to have to agree to agree.
Great. But thank you very much for inviting me. I enjoy chatting.
No fighting today. Look, thank you very much. It's been an absolute pleasure. And maybe we can do it again and pick a topic and have it, do a bit more of a deep dive.
Yes, can do that.
That would be great. Yeah. All right. Well, you have the great rest of your evening. And my day's starting here, so we will talk another time. Thank you very much.
Yeah, thank you, everyone.